Welcome back to another GNED 225 lecture. In the last class, we learned about how antibiotic works against bacteria. We learned about some basic concepts related to evolution. And today, in this lecture, we will be looking at the emergence of superbug. We will talk about what superbugs are, the misuse of antibiotics, and how that contributes to the emergence of superbug. And lastly, we'll be looking at the ethics related to antibiotic use. Let's go through some background information. We learned that antibiotics are medicines used to prevent and to treat bacterial infections. Antibiotic resistance occurs when the bacteria change in response to the use of these medicines. Once the bacteria becomes resistant to an antibiotic, it basically cannot be killed by that antibiotic anymore. So if a bacteria becomes resistant to amoxicillin, okay, then you will have to treat it with another type of antibiotic. And usually, it's possible for a bacteria to become completely resistant to a whole group of antibiotics. So not just amoxicillin, but all of the penicillins. And that becomes very difficult to treat those types of infections. When we use the word resistant to describe the situation, we are referring to the bacteria becoming antibiotic resistant. The resistance is not talking about the humans or the animals. It's the bacteria that become resistant to the antibiotic. So these bacteria may then infect humans and the animals, and the infections they cause are going to be harder to treat compared to those that are caused by non-resistant bacteria. So what are superbugs? Superbugs are bacteria that are resistant to multiple antibiotics, and any species of bacteria can actually turn into a superbug. Here are a few common ones that are particularly concerning to healthcare system today. We have MRSA, which stands for methicillin-resistant S. aureus, which is a type of bacteria that has become resistant to methicillin, one of the stronger penicillin out there. And they could cause infection in different parts of the body. And they are really tough to treat because, as I mentioned, even the strongest penicillin out there is not going to be able to kill them. Over here, we have something called CRE, which is a type of bacteria that has become resistant to carbapenem, and a class of antibiotic that is used to treat severe infections. And lastly, we have something called VRE, which is vancomycin-resistant enterococci, a type of bacteria called enterococci that have developed resistance to many antibiotics, especially vancomycin. And vancomycin is even stronger than the methicillin we mentioned earlier. So enterococci bacteria live in our intestines and on our skin, and usually without causing any problem. However, if they do become resistant to antibiotics, that's when they can cause serious infection, especially in people who are ill or immunocompromised or weak in general. These infections can occur anywhere in the body. Common sites include intestines, urinary tracts, and wounds. You might remember seeing these cultures from last lecture. These are bacterial culture that we can grow bacteria on them. So here on the left picture, you can see that there are these white circles. Those are actually the antibiotics. Okay, so on the left plate here, we are placing various antibiotics around the plate, and you can see around the antibiotic, there is a clearing area. Okay, so this clearing area means that there are no bacteria growing in the vicinity of the antibiotics, and that's kind of what you would expect if the antibiotics is effective. It essentially prevents the bacteria from growing. and in some cases killing them as well. So in the left culture here, you can see all these antibiotics are doing the job. You always see a clearing area around each of the antibiotics, and that means the bacteria is not resistant to any of the antibiotics here. Now, on this culture, we are growing a resistant bacteria, okay? And in order to find out what antibiotic it is resistant to, we would do the same thing. We will put antibiotics on the plate and just let the bacteria grow. So you can see this antibiotic, this one as well as this one, they are no longer effective in killing the bacteria. The bacteria doesn't even care that the antibiotic is there. They just grow right up to the antibiotic. You don't see an area of clearing around it, and so that means the bacteria is resistant to these three antibiotics, and you know, if someone comes down with an infection caused by this bacteria, giving the patient these antibiotics will not help at all. And you can see here the middle one, this antibiotic, there is still some effectiveness left to it. The clearing area is not as big as the effective antibiotics. Okay, so comparing the clearing area, this antibiotic works quite well, but then this one is not as effective. And over here, on the top left corner, you can see this antibiotic is almost losing all of its effectiveness. The clearing area is virtually non-existent. So this is one way of how we can check to see what antibiotics are still effective in treating an infection caused by these antibiotic-resistant bacteria. Okay, so if you have a superbug, like a one that is resistant to 5 or 6 antibiotics, then you would expect no clearing area at all on the plate, even though you have multiple antibiotics on the culture. So how do bacteria become antibiotic resistant? First, antibiotic resistance is actually a natural phenomenon. It is something that's going to happen in nature, and it has been happening for a long time. So even without human actions, some resistance would occur anyway. In fact, some bacteria can produce antibiotics themselves and use it against other bacteria, and that could lead to some low-level natural selection for resistance to antibiotics. We learned about natural selection last class, and just to quickly recap, natural selection basically means if there is some heritable traits that gives the organism some survival or reproductive advantage, then that trait will increase in the population over time. Okay, over several generations, you will see those favorable traits increase in the individuals of that population. So in the context of antibiotic resistance, some genetic mutations occurred in the bacterial genome, okay? And this mutation gives them some kind of survival advantage, okay? And then, you know, where do these mutations came from in the first place? Well, these mutations can occur randomly as a result of mistakes being made during DNA replication, when the bacteria divides. So we talked about how before a cell divides, it must copy all of its genetic material, right? And because there are a lot of genetic material to copy, it's not uncommon for mistakes to occur, and that results in mutations. Okay, mutations can be neutral, could be increasing the survival of the bacteria, or in some cases it could be deleterious. It could be bad for the bacteria. And so, if the mutation is good, if it gives them a survival or reproductive advantage, then that mutation is going to increase in numbers in the bacterial population over time. So, in the context of antibiotic resistance, the genetic mutations that is advantageous to the bacteria's survival in the presence of antibiotics would include some of the following. For example, there could be a mutation that gives the bacteria the ability to prevent the antibiotics from entering the bacteria. If the antibiotics cannot gain entry to the bacteria, then they cannot exert their effects. So that would be a good mutation to have, okay? And that certainly is the case for the gram-negative bacteria that we talked about, right? They have an extra plasma membrane layer. So maybe long time ago, there was a mutation that caused the bacteria to have that extra membrane. And then over time, that's how the gram-negative bacteria becomes evolved, because they are more resistant to antibiotics. They might have a mutation that allows them to pump out the antibiotics, even if they make it into the bacteria's interior. They could evolve ways to block the antibiotics. They could even evolve ways to destroy antibiotics. So these are not hypothetical mutations. These are actual mutations that are found in superbugs that allows them to become resistant to the antibiotics. And so, if they start sharing these informations with other bacteria through genetic transfer, then that's how you create superbugs. We talked about the ability to transfer genetic material between two bacteria through the process of conjugation last time. So you might remember we had a picture, one bacteria, two bacteria, and then this one has a red plasmid and this one has a blue plasmid, and they could actually exchange the genetic material through the pilus here. Okay, and this process is called conjugation. And it's essentially transferring genetic material between two separate bacteria, and we call this horizontal gene transfer. Once the bacteria acquire a new trait, it can then pass on to all the generations after that. So let's say this bacteria A and bacteria B, they exchange the genetic material, and then afterwards, this one would have the red one, and this one will have the blue one. And let's say they're finished with the conjugation process, then what happens when this bacteria divides? Well, when it divides, then all of the future generations will also have the exact same plasmid, okay? Even though originally only had the blue, but because it got the red from another bacteria, all of the future generations will have the same advantage. So this type of transfer from the parent bacteria to the offsprings, this is called vertical gene transfer. And if you're doing it between two bacteria, this is called horizontal gene transfer. Okay, so horizontal gene transfer is a way to basically increasing the genetic diversity of the bacterial population, whereas vertical gene transfer ensure those variations are going to be passed on to all future generations. Last class, we also talked about the core chemical structure of penicillin, and it is something called the beta-lactam ring. Okay? The beta-lactam ring is the part of the penicillin that allows it to block the bacteria's ability to build a cell wall. Okay, so remember, bacteria, they keep on remodeling their cell wall, right? They break it down on one side and then they rebuild it. But in the presence of penicillin, it's going to interfere with the building part. So essentially, the bacteria just tear down its wall, but have no way of rebuilding it. So that's how penicillin works, right? It uses the beta-lactam ring to block the rebuilding of the wall. So some bacteria has a mutation that allows them to make something called beta-lactamase. Okay, beta-lactamase. So beta-lactamase is a molecule that can destroy the beta-lactam ring. Okay, so this beta-lactamase will destroy the beta-lactam ring. And once the beta-lactam ring is destroyed, the penicillin will no longer be functional, and it will have no effect on the bacteria. So here you can see on the left diagram, we have a generic penicillin drug, and you can see the purple ring here is the beta-lactam ring. Okay, so beta lactamase, which is the thing that these bacteria have, it's like a pair of scissors. Okay, they are gonna come. The beta lactamase is gonna come, and it's gonna cut the ring. And you can see the ring is popped open now over here, and this is going to be inactive penicillin. Okay, and if the bacteria has the beta lactamase, it means that penicillin will no longer work on them. Let's say here are some bacteria. There's a group of bacteria over here, and only some of them would have the beta lactamase. Okay, so they are the ones that by chance has evolved to have a mutation that allows them to make these scissors, right? These beta lactamase, and then over here we have the ones that don't have the beta lactamase. And suppose you now introduce an antibiotic, right, penicillin, okay, into this population, okay, penicillin into the population, okay, then what happens is the penicillin will not be able to kill the ones with the scissors. They won't be able to kill the one with the beta lactamase, but they will start to kill off these ones. Okay, so what happens is because we have a stressful environment right now for the bacteria, these bacteria might exchange genetic material with the ones that are dying. Okay, because that's what they do when there's a stressful environment. They want to mix up the gene pool a little bit, and they start to perform conjugation. And through conjugation, through the exchange of genetic information, these ones might now be able to make the scissors, the beta lactamase as well. Okay, and then when these bacteria makes the beta lactamase, the penicillin would no longer work, and so the bacteria can actually divide and make more bacteria. And what's really scary is all these bacteria that are coming from the original, all of them will have the beta lactamase, and that makes the population resistant to the penicillin. Okay, so this is an example of natural selection, right? Because the beta lactamase is a favorable trait in the presence of penicillin, and so the bacteria that do not have the penicillin, they all died off. Okay, and the remaining ones can either gain it through horizontal gene transfer, and once horizontal gene transfer is completed, all future generations will have the beta lactamase. Okay. To kill off the bacteria that makes the beta lactamase, okay, so, in other words, to kill off the bacteria that have the scissors, okay, pharmaceutical companies have spent a lot of money developing a new antibiotics, and one of the new antibiotics that they come up with is belonging to the class of what we call beta lactamase resistant beta lactams. Okay, what that basically means is that scientists have found a way to make the penicillin with a stronger beta lactam rings, so that the bacteria cannot cut the rings even though they have the scissors. So in this picture, you can see the beta lactam ring has been reinforced. Okay, has been strengthened, shown here by red. And when the beta lactamase, the scissors, try to cut it, basically the scissors breaks. Okay, the beta lactamase is no longer going to be able to break the penicillin, and so it's still going to be able to kill the bacteria. So to put it in proper terms, that means the beta lactamase can no longer destroy these beta lactamase resistant beta lactams. Unfortunately, that created new selection pressure for the bacteria because the environment has changed now, so that natural selection is now going to be selecting for a different trait, and that causes the population to evolve further. Eventually, bacteria becomes resistant to the beta lactamase resistant beta lactams as well. So it's like they've evolved to use chainsaws to cut the ring instead of using the scissors. And this basically sums up the situation for developing new antibiotics and bacteria evolution. It is basically an arms race, between coming up with better antibiotics to attack the bacteria, and the bacteria coming up with defenses and strategies to resist those attacks. And so far, it's not looking good for humans. We are actually lagging behind significantly when it comes to antibiotic developments compared to how fast the bacteria is able to evolve and become resistant. Let's now take a look at some examples of how human activities are speeding up the process of antibiotic resistance in bacteria. The first one is overprescription of antibiotics. Antibiotics only work against bacterial infection. It does not work against viral infections like cold and flus. Okay. Unfortunately, if you go to your doctor and you tell them you have a sore throat, and you're not feeling well, most of the time we're not going to be able to tell whether you have a viral infection or bacterial infections. Okay, so as a precaution, a lot of doctors just give you antibiotics and to treat you, even though you in fact had a viral infection. Nowadays, because of the emergence of Superbug, a lot of doctors are more conscious now. So they might do like a throat swab, take a sample of a sample from your throat basically and go culture it to see if there are any bacteria. And if the test comes back negative, then no antibiotics are necessary. But if it comes back positive, then they will put you on the antibiotics. But of course, that takes time, and sometimes that the 1 or 2 days or 2 or 3 days even, that those 3 days before while you're waiting for the results. If it does turn out to be bacterial infection, then you're kind of delaying the treatment. But at the same time, they don't want to give you a treatment that won't help if it turns out to be a viral infection. So the CDC, the Center for Disease Control, had an estimate that 1 in 3 antibiotic prescriptions by physicians are actually unnecessary. Okay, and by prescribing antibiotics when they're not necessary, it adds selective pressure that would favor the growth of bacteria that has the resistance, and therefore it drives the evolution and the creation of these superbugs. The second common problem is that patients do not finish their antibiotics. If you take antibiotics before, you probably remember your doctor or your pharmacist would tell you to finish the entire 7 days or even 10 days in some cases worth of antibiotics. And what happens is many people started to take the antibiotics, and then as soon as they feel better, they stop taking it. And that could be a bad situation, because as we mentioned earlier, let's say you got infected by a bacteria, and these are the normal ones, so to speak, and then just by chance, this might not happen to all the infections, but in some infections, just by chance, maybe one of them is going to be resistant. Okay, so I'm going to make this like red guy. Okay, and these two are going to be resistant. So what happens is when you take the antibiotics, okay, the antibiotics will kill off these ones, okay, right away. Okay, and then after 2 or 3 days, the person might feel better because the bacteria are actually dying, right? And if you stop taking the antibiotics right now, then you give a chance for the resistant ones to divide. Okay, so if they divide, then you would get more. Okay, you get more, and then they could even transfer the genes to the non-resistant one. Okay, so you killed off a majority of the normal ones, but then you might left behind 1 or 2, and if those 2 get the resistant gene from the red ones, then they too become resistant, and when they divide, all of them will also be resistant. Okay, so it's similar to the scissors thing that we talked about earlier, right? And then the person could actually start feeling sick again. And if they resume their antibiotics at that point, it won't be helpful anymore, because now these bacteria are all resistant to the antibiotics. Okay, so you should always finish your antibiotics. And what that does is, let's go back a little bit. Okay, so again, you took your antibiotics and then you killed off a majority of the bacteria. And if you keep on taking it, even though you feel better, you will kill off the remaining ones. And then your white cells will not be overwhelmed. Your white cells will not have to worry about the normal ones. They can just focus on eating up the superbugs. And if the white cells eat them up, then they won't be able to replicate. And you will be cured essentially. Okay, so always finish your antibiotics treatment as instructed by your doctor and pharmacist. Next problem is the overuse of antibiotics in livestock and fish farms and in agriculture in general. The antibiotics are often used as growth promoters in animals, or they're used to prevent diseases in healthy animals. We'll take a closer look at why this is a problem later on. But for now, just to give you a brief summary of what's going on with the overuse of antibiotics in livestock and fish farms. Poor infection control in hospital and clinics is another factor that speeds up antibiotic resistance. This might not be a problem with developed countries like Canada or the US, but as we mentioned before, many developing countries, they actually lack basic healthcare infrastructures, and they might not always have the capacity to quarantine a patient with superbug infections, for example, and that could easily cause an outbreak at the local hospital. And with globalization these days, traveling from one country to another is very, very easy. So a superbug that emerged in a third world country, for example, is always just a flight away from getting to like Canada or to the US. And here is an example of where people were having surgeries abroad, in Mexico in this case, and they actually contracted the superbug at the hospital, and then they went back to the United States and brought the superbug with them. And this is not an isolated case. If you do a Google search, you will find there are many of such instances, and it's happening in Canada as well. And sometimes it's not just antibiotic resistant bacteria that people can contract from abroad. They could also contract multi-drug resistance yeast as well. Antibiotics don't kill yeast, but then yeast have their own class of drugs, and they're becoming multi-drug resistance in that respect as well. So that's why what happens in other countries will ultimately affect us as well because of globalization. The next one is the lack of hygiene and poor sanitation, which obviously leads to an increased bacterial growth and potentially spread the resistant genes faster. And with COVID-19 going on right now, people are definitely more aware of general hygiene these days, with hand washings and basic sanitizing practices. So that might be one positive thing that came out of the pandemic, I suppose. But in general, having poor hygiene and sanitation is definitely something that would contribute to the speeding up the bacterial resistance process. Earlier, we talked about the arms race we have between coming up with new antibiotics and how the bacteria is able to evolve. And due to the widespread of resistance, new classes of antibiotics are urgently needed. And so we are actually not able to come up with a new antibiotics at a fast enough pace to keep up with the evolution. And that certainly has contributed to the emergence of superbugs. Since the original discovery of penicillin by Alexander Fleming, the number of new antibiotics we are able to come up with that are being discovered or approved has been on a steady incline. And I will actually post a video on eCentennial that explains why it is so hard to find new antibiotics later. And just to give you some stats, between 1983 and 1987, only 16 new antibiotics had FDA approval, and since 2003, only 7 were approved. So the pipeline, as they say, where it's kind of drying up. We are not really coming up with new antibiotics as fast as we should be. And to add to the problem, you can see on this picture, it's a timeline of antimicrobial resistance, antibiotic resistance. Okay, I know you cannot read any of these, but the important thing is that on the left side here, on this left line, that shows the new antibiotics that was developed, and on the right here, it shows the time when the bacterial resistance to those antibiotics was identified. So, for example, we can look at something called tetracycline here. Tetracycline is used as well, it's an antibiotic, okay, and it is used to treat things like pneumonia, right, which is like a really bad bacterial lung infection. It could use to treat infections of other respiratory illnesses caused by bacteria, urinary tract infection, and a few other things. And that was developed in 1950. Okay, and if you follow the blue line here, if you follow the blue line, okay, from the tetracycline all the way to over here, you can see bacteria that are resistant to tetracycline was first identified in 1959. So within 10 years of the discovery of tetracycline, the resistant strain was identified. And sometimes it is actually much sooner. So there is another one down here. Okay, this one is called levofloxacin. Levofloxacin, I think that's how you say it, and it is an antibiotic that is not related to penicillin at all. It actually works by blocking DNA replication, and that was first discovered in 1996. But the bacterial resistance to levofloxacin was identified in the very same year. If you follow this line here and you just go across, and you can see in the same year that they discovered and developed that new antibiotics, bacteria already become resistant. And so, based on this chart, you can see antibiotic resistance is an inevitable outcome of antibiotic use. Okay, we cannot prevent it from happening. Okay, because it's just, like I said, a natural phenomena, right? But what we could do is to try to slow down this process, okay, by avoiding some of the things that we talked about in the last 6 or 7 slides, okay. And you can see we are always kind of playing catch up most of the time, trying to beat the bacteria's evolution speed. Now let's take a closer look at the misuse of antibiotics. In the US, over 70% of the nation's annual antibiotics consumptions are actually used in food animals. Okay, many of the antibiotics in the livestock are also used in human medicines. So what that means is, if the bacteria become resistant in the animals, that will also affect humans, because those drugs will now no longer be effective in humans infected with those resistant bacteria as well. And so, because of that problem in Canada, at least, there was a set of new rules that took effect for farmers on December 1st, 2018. And the new rules states that aims to reduce the use of antibiotics in Canada. And after the rules came into effect, basically livestock farmers will now require a veterinarian prescription to treat their animals with antibiotics. And these changes came from Health Canada, and the aim again is to curb the situation with superbug emergence. And it's a right step. It's the right call in the right direction for reducing the emergence of superbugs. But some farmers have complained that the new rules will cost them more for veterinarian services when they used to be able to just purchase antibiotics over the counter and feed it to their animals. And of course, whenever the cost goes up for the farmers, for example, then ultimately some of that cost is going to be translated to consumers. The meat might now be more expensive, for example. Let's take a look at why antibiotics are used in farming at all in the first place. Here are some pictures of chicken farms. If you've never seen them before, you might be surprised to see that they are actually super packed, and they are often placed in quite confined space. So it is very easy for diseases to spread, when the density is so high, and the chickens are basically touching from head to tail, right, so to speak. So if there is some kind of illness is caused by bacteria, the entire flock could become infected. And obviously this is horrible for the animals because they're gonna die from the infection potentially. But it's also going to cost a lot of money for the farmer if the entire flocks dies, because they basically have nothing to sell for that cycle. And so to prevent the herds or the flocks of animals from getting sick from bacterial infection, they are generally treated collectively with antibiotics, even though they're not sick at all. Okay, the antibiotics are used to as a preventive measure, and they are often given to the animals through their feed, right, through the food or the water, and this makes it very hard to control the dose, raising the risk that the animals experience suboptimal levels of antibiotics. So what suboptimal level means is that the antibiotics is not at a high enough dose that would kill off a significant percentage of the bacteria. And so you kind of always leave some behind, so to speak. And that's exactly the same situation as not finishing your antibiotic. When you're not able to wipe out all the bacteria, the ones that are left behind, the one that survives, means they had some survival advantage. And that's the one that are going to continue to evolve, and ultimately they could become bacterial antibiotic resistance, and if that causes infection in people, then it becomes very difficult to treat. The resistant bacteria can spread to humans through various means. Okay, the most direct means is the farmers who are tending to these animals. They might contract the illness directly from the animal, but consumers are not safe from them either. We could get it from handling the meat. Say we wash them in our sinks, and then we have an open wounds in our fingers. That's way we can catch the superbugs. We could wash our produce. If you wash your vegetables and fruits in the same sink that we washed our meat without cleaning them in between, it's possible that the bacteria will end up in the produce, and we eat our produce raw most of the time, and that of course could be a problem. It's also possible that fecal matter from animals could end up in our food, and when we consume them, and it's contaminated with superbugs. That's another example of how we can get it. You might remember, I think like last year maybe, in 2019, there were several flowers recall in Canada, and it was actually traced back to wheat being contaminated with animal feces containing the pathogens. So it's not uncommon for these things to happen. Now that wasn't superbug that was contaminating the flour, but it certainly could have been, and that's how these things could get into the human population. Nowadays, people are more aware of these issues, right, with antibiotics in the food, in the meats, and they're more conscious about the type of meats that they buy. But there are some food labels out there that are very, very misleading. For example, you can see all natural. If you see the meat is labeled as all natural, you might assume that means it's good, it's healthy, but actually that's not what it means at all. According to regulations, all natural just means that the meat contains no artificial ingredients such as added colors, and that they're minimally processed post slaughter. Okay, so after the animals died, so we don't know what happens when they're growing them. They could be fed with growth promoters, antibiotics. We have no idea. All natural just means after the animal died, there was minimal processing. Okay, so essentially, it doesn't really mean much. Okay, basically most of the meats could be considered as all natural, unless they are marinated with sauce or whatever. But that's a whole different set of products compared to regular meats that we buy. Another ones that is quite common that you see is no hormones or steroids added. So you don't have to give them antibiotics to promote growth. Okay, sometimes growth hormones, for example, or certain steroids are used as promoters. So when they say no hormones or no steroids, that just means those things were not used. But antibiotics still might be used in the growing process. And you might see there are labels that are called antibiotic free, and this one sounds pretty promising, right? But again, actually, as long as the animal met a specific withdrawal period prior to being slaughtered, then they could be called antibiotic free. So that means, I don't know what the withdrawal period is, but hypothetically speaking, if 2 weeks before they are killed, as long as within those 2 weeks they didn't receive any antibiotics, then we can say it's antibiotic free. Okay, and that means early on in the growing process they might be fed antibiotics. Nobody knows. So the safest one label, okay, that is kind of authentic, would be organic. Okay, so organic means it cannot be given antibiotics ever. Okay, during the entire growth of the animal. Okay, but there is a catch. For chickens, it means that the chickens, after it's hatched, they are not given antibiotics, but sometimes the antibiotics can be injected directly into the egg or on the day that they're hatched, and that's still going to be considered as organic. Okay, basically that's how people can now make an informed choice, I guess. When you read the labels, you have a better understanding of what it is. So other options are available, but typically these are quite expensive. If you ever look at the price of organic meat, for example, it is almost 2 times and even 3 times in some cases as expensive. If you go to Whole Foods or something, the meats there are supposed to be all organic, but they are very, very expensive. So it might not be affordable to everyone. And even if it's affordable to some people, they might not want to pay as much because there are no immediate, tangible, noticeable difference that they can see, and so not everybody would opt for that option. Fish farms also has similar problems. You can see they are just as crowded as the chicken farm that we saw earlier. And in fish farms, antibiotics are generally given as part of the feed as well, but may not be wholly consumed by the fish on the farm. And that leads to the same situation as before. If we don't know how much we're giving to the fish, then it's very possible that there is going to be a suboptimal level present, and that drives evolution. Poor sanitary condition encourage the growth of bacteria in these fish pans, and high fish density promote the rapid spread of the antibiotic-resistant bacteria on the farm when they emerges. And there one additional problem with the fish farms, and is that they are often near fresh open water, and so you can see, the fish farm is actually built directly adjacent to the ocean, right? And in that case, when there are resistant microbes that form, they could rapidly disseminate through the water to other farms and even to the wild animals, and that is a very bad thing. In the 1980s, Norway and other northern countries with plentiful flesh and seawater resources experienced an explosion of salmon farming. So before that, salmon was considered as a delicacy. Only a privileged field would be able to enjoy them. But with fish farming, salmon became available worldwide at a more affordable price. The main issue with salmon farming was that thousands of farmed salmon were actually affected by something called furculosis, which is a bacterial infection in the fish. And you can see this is a salmon that has been infected with the furculosis, and nobody's going to buy that, and probably not safe to consume anyways. And so antibiotics was used in feed to fix the problem. And eventually in the late 1980s, the public health of Norway basically recognizes that there is a need to come up with a way to support the Norway's fish farming industry without endangering the public health. And so scientists at the Norwegian Veterinarian Institute, they developed an effective vaccine against furculosis in farmed salmon. And that has no side effects on humans. And that's an example of using an alternatives, the vaccines, instead of antibiotics in farming. And Norway has been praised as one of the few countries that essentially use no antibiotics in their fish farming practices. Here is a flowchart that shows how antibiotic-resistant bacteria can spread in our community. So we talked about how antibiotics are being fed to animals, and then in the guts of those animals, bacteria can become resistant, and the fecal matter from these animals may go and contaminate the fertilizers or water, and then they end up in our crops, for example. And if we consume those crops, then it gets into the human population. Similarly, if we consume the meat that is tainted with the antibiotic-resistant bacteria, then we might get sick. Sure, I mean, we cook our food, right, and eat it. But if you eat your steak, and some people like to have a little bit of blood on it, then certainly the bacteria might not be killed completely through the cooking process, and that could cause the resistant bacteria to go into the population. And so, if the person gets sick, they would go into the hospital, and within the hospital, if the person is not isolated, then they could spread to other patients, right? They could also spread it to healthcare providers, and very quickly, this could disseminate throughout the human population. Let's take a look at TB, tuberculosis, as an example of antibiotic resistance. TB is one of the top 10 causes of death worldwide, and 6 countries accounts for 60% of all the total cases, with India as the leading country, followed by Indonesia, China, Nigeria, Pakistan, as well as South Africa. And TB is actually caused by this bacteria here, and that bacteria is called the Mycobacterium tuberculosis. Okay? And it often affects the lungs. The good news is tuberculosis is curable and preventable. And just like any other bacteria, they had become they could evolve and become resistant. And there are two strains of TB that are resistant to antibiotics. We have the multi-drug resistant TB, and then we have the extremely drug resistant TB. Okay, and there are two reasons why multi-drug resistant TB continues to emerge and spread. The first reason has to do with the mismanagement of TB treatment, as well as person-to-person transmission. Most people with TB are cured by a strictly followed drug regimen that lasts as long as 6 months. Okay, and during that time, during the treatment time, the person might still be infectious, and they could be transmitting to other people. Treatment options are limited, okay, and as you can see, it lasts 6 months, so it's quite expensive, and the recommended medicines are not always available. And on top of that, patients actually experience many adverse side effects from the drugs. So those two things combined makes it very difficult to completely treat all the TB cases, even though a treatment is available. Worldwide, only 52% of the multi-drug resistant TB patients would be successfully treated, and for the extreme case, the really, really resistant TB, only 28% are currently successfully treated. Here you can see a doctor holding up a drug regimen for people who have to take the daily pills that people have to take when they have the multi-drug resistant TB. And the list of side effects is quite long. Some patients permanently lose their hearing, experience psychosis, or feeling constant nausea. Their kidneys can fail. Their hands and feet can stink with pins and needles sensation. And despite such difficulties, it's crucial for patients to start and stay on the right medication in order to save their lives and also to prevent them from infecting others. But something like this is very expensive, and with the really, really bad side effects, it's hard for people to endure, and so that's why the successful treatment rate for the multi-drug resistant TB is very, very low. The cost associated with treating TB also increases with the resistant strain of the bacteria. You can see treating someone with MDR TB costs nearly 6.5 times as much as the regular TB costs, and for the treatment for the XDR TB, it costs as much as 15 times compared to treating regular TB. The cost also factors in things like productivity loss due to treatment itself. When a person is infected, they cannot go to work in most cases because they need to avoid spreading it to other people, or they are actually feeling too sick to work, and that results in productivity lost. In the last part of the lecture, we will be looking at some ethical issues with antibiotic use. And here are 4 things to consider. Infectious disease control, fair distribution of global resources, veterinarian antibiotic use, as well as something called intragenerational and intergenerational justice. Ethical policy for infectious disease control should aim to strike a balance between protecting the rights and liberties of infected individuals and promoting the greater good of society in public health. So the top measure from public health care to combat any infectious disease, such as superbugs, for example, include things like surveillance, isolation, and quarantine. And we are quite familiar with this concept now because we do have a pandemic going on. And on the other hand, basic human rights encompasses things like privacy, freedom of movement, as well as autonomy. So these two lists are for the most part, in direct conflict with each other. If you put someone in quarantine, then that is basically limiting one's freedom of movement. And if you put in robust surveillance system, then that's intruding someone's privacy. So often, the public health measures needs to be balanced with basic human rights concerns. So COVID-19 outbreak that started in China's city of Wuhan, which of course has now become the global pandemic. But when the outbreak was first started in Wuhan, which has about 11 million citizens in that city, the Chinese authorities have responded by essentially shutting down all travels into and out of Wuhan. The city was in lockdown. And not just Wuhan, the adjacent cities were also in a lockdown, and that basically meant there was harsh restrictions for more than 35 million people in total. So the Chinese government's rationale for such wide-scale shutdown was an attempt to prevent the virus from spreading further within China. So the travel shutdown lowers the risk of residents of Wuhan or nearby cities from carrying the virus elsewhere. The action of the Chinese government, the lockdown, raised a number of potential ethical issues, including basic human rights concerns about restricting a group of people who are within an epidemic area to that area. And additionally, if you do something like that, locking down the city, then getting health supplies into the city and getting care for the people in the city who are sick, all of that's going to become more difficult with restricted travel. And of course, those who are in the city that are not sick, they can't leave, and they are actually very concerned that by staying there, they might contract the illness from the population, which majority of them was infected at the time. And so those are the ethical concerns associated with very robust lockdown measures. There were actually many Canadians who were stuck in Wuhan when the lockdown took place, and they had no way of getting out of the city. Some tried to reach out to the Canadian embassy, but there was no quick, immediate solution for getting them out. Eventually, I think a month or two later, the Canadian government were able to get a charter flight to bring some of them back, but still there was a long wait period. Now, lockdown is a very extreme measure. So let's look at something as simple as wearing a mask. Wearing a mask has shown to be an effective way of reducing the spread of virus, the COVID-19 virus, and yet many people are refusing to do it. There are certainly more protests that are going on against wearing a mask in the US, but there are also a significant number of oppositions that are going on in Canada as well. And you can see some of the signs that people are holding up. Right? A society that thinks it can trade freedom for safety will get neither in the end. People are saying it's my body, so it's my choice. It's kind of borrowing the slogan from anti-vaccines movement. So, I know we're talking about Superbug here, but it's essentially the same thing, right? What's happening with the COVID-19 could exactly be what's going on with a Superbug outbreak. Anytime we have public health measures that are imposed on the population because they're trying to maintain safety of the public health, it's likely to be some kind of intrusion against personal liberties. And we talked about harm's principle before when we discussed vaccination mandate. A person's free choice and actions can only go as far as a point where it doesn't inflict harms on others or interferes with the safety of others. So wearing, if a person chooses not to wear a mask, um, then that person could be endangering the public health, and so they might have to comply in the end. So that's just an example of how there are a lot of ethical concerns when it comes to public health measures versus personal rights. Another ethical concern is the fair distribution of antibiotics. This is a very similar situation to vaccination. The burden of antibiotic resistance, or ABR for short, disproportionately affects low and middle income countries. As expected, more people die from lack of access to high quality antibiotics in low income countries than high income countries. And weak healthcare systems are less likely to be able to address the challenges of ABR by themselves. So health facilities in many low and middle income countries are substandard, and lack of staffing who are properly trained in administering antibiotics. Take Uganda, for example. 10 to 54% of health staff posts are unfilled because of poor pay, high stress, lack of resources, and poor management. So staffing on wards is inadequate to administer medicines. As a result of that, patients miss antibiotic doses. The public nurses sometimes request compensation for administering medicine as well. And in India, there is one government doctor for every 10,189 people. Okay, and the World Health Organization recommends a ratio of 1 to 1,000. Okay, so there is a severe shortage and a deficit of doctors in these developing countries. And another problem is in low and middle income countries, there is a weak drug supply chains, and they fail to make antibiotics consistently available. So take Uganda, for example. Again, researchers found that many products were stored and transported long distance without cold temperature control, and only 47% of the medicine on the World Health Organization list of essential medicines were procured through the centralized authority, and that results in chronic shortage. Moreover, private supply chains delivery systems were not leveraged to improve drug availability outside of specific programs, and as a result, it becomes very difficult to have access to antibiotics. A lack of oversight and regulation in drug manufacturing and supply chain resulted in poor drug quality, as well as the emergence of counterfeit medicines. In fact, 17% of all the substandard or falsified medicines that are reported to WHO are actually antibiotics. And each year, more than 169,000 childhood pneumonia deaths are actually caused by these fake antibiotics, because they're given to the kids and they're not actually helping with the disease, and as a result, they die from it. Here is veterinarian antibiotics, and I will just present to you two ethical questions for you to think about. Number one, is it morally defensible to ban certain antibiotics in livestock while allowing unrestricted access to these products in companion animals? Companion animals are like pets, right? Like your dogs and cats and whatnot. Another question is, should an entire class of antibiotics be exclusively reserved for human use if that means certain treatable infections would no longer be curable in the veterinarian sector? Okay, so you can think about these questions. Usually, you might be biased towards one side over the other, depending if you are you have a pet animal, for example. But try to think about arguments from both sides. Lastly, intra-generational, that means the same generation, versus intergenerational, which means future generations. So with the decrease of antibiotic effectiveness, an ethical conflict emerges for the fair distribution both within and across generation. Meaning, if we say come up with new antibiotics, and we know using it now in this generation is going to likely prompt the resistance to occur. So should we hold off from using these antibiotics in this generation so that we can save the drug for our future generations? That's essentially what this is. This is about. Okay, so how should we allocate this increasingly scarce public good, the antibiotics? Is it fair if we leave future generations without effective antibiotics? So why should we be concerned about superbugs? Why do we care? Well, antibiotic resistance can affect any person at any stage of life. And people receiving healthcare or those with weakened immune system are often at higher risk for getting an infection from these superbugs. And the superbugs actually jeopardizes advancement in modern healthcare that we have come on rely on. Such as organ transplant, cancer therapy. All these things are not going to be possible without the use of antibiotics. And aside from healthcare, antibiotic resistance also impact, as we saw, veterinarian industry as well as agriculture industry. And there is a huge burden on the healthcare costs for treating infections caused by superbugs. The financial burden could be as much as 20 billion annually, and lost productivity can go as much as high as 35 billion dollars. Annually as a result of people getting sick from superbug. And of course, there is a greater risk of death as well if you do get sick from superbug because there are limited drug treatments available, and we might return to an era where infectious disease becomes a major cause of death in human society once again. Right? Remember, one of the reasons that we are able to have such long life expectancy is primarily due to the discovery of vaccines and antibiotics. And now it seems like people are not vaccinating as much as they should, and the antibiotics are losing their effectiveness. So together combined, these could undo major medical advances. And that could significantly shorten the life expectancy of the human population once again. So it's not all gloom and doom. What can be done? Well, according to the CDC, the Centers for Disease Control, to prevent and control the spread of antibiotic resistance, we as individuals, we can do the following. Okay, we can only use antibiotics when prescribed by a certified health professional. We should not demand our doctors to give us antibiotics when they say you don't need it. Okay, so it's not uncommon for people to go to a walk-in clinic and then if they don't get any antibiotics, they visit another one, right? And they kind of hop between clinics until they get the antibiotics. So we shouldn't do that. Okay, if the doctor said you don't need it, then maybe you don't need it. Okay, and always follow your health workers' advice when using the antibiotics. You should finish it and never share the antibiotics with anyone. Okay, some people save their antibiotics for another time. We should not do that. Okay, and just basic hygiene things, right? Washing your hands, preparing your food hygienically, and avoid close contact with sick people. All these things are going to help help with slowing down the emergence of superbugs. And as policymakers, they could help by ensuring there is a robust national action plan to tackle antibiotic resistance and to improve surveillance of antibiotics resistant infections. They could also strengthen policies and programs and implementations of infection prevention and control measures. And they can regulate and promote the appropriate use and disposal of quality medicine, and basically just make information available to the public regarding to the impact of antibiotic resistance. And in the health industry, they should invest more money in research and development of new antibiotics, vaccines, as well as diagnostic tools. And in fact, many people are now trying to come up with entirely new way to treat bacterial infections. Maybe the solution is not to find more antibiotics. Maybe it's time to look at other form of treatments that doesn't involve the use of antibiotics at all. Some people have tried to come up with proteins that would destroy bacteria, and these new ways might revolutionize how we treat bacterial infections in the future. And in the agriculture sectors, people could refrain from using antibiotics as growth promoters and only give them to animals that are actually sick under veterinarian supervision. And they could opt to vaccinate their animals to reduce the need for antibiotics, and practice and apply good sanitary conditions for the animals. All of those could actually significantly reduce the risk of having superbugs being formed at the high pace that we are observing right now. So that's it for this lecture. The next class, we will be talking about organ transplant. Okay, so thank you for watching, and I'll see you next time.